I like it. I like wearing black, actually. I mean,
I should have given you a mock turtleneck. It would have been better.
Hawaii. I look like a hipster this way.
Okay, phone's off.
Jay wants the young crowd. It was very good the other day, the panel.
It was.
Yeah, it was that was serious. We had 8 or 10 people, directors and legislators and committee chairs and stuff, and everyone had we had 5 minutes and then some questions, and the questions worked out well because they asked them quickly and demanded fast responses, which is the only way really to do question and answers properly.
That was very fast, wasn't it? Gee whiz, they were.
Oh yeah, but that's good. Tell people you got 20 seconds to answer the question, and we're moving on, and you get so much more. 20 seconds into an answer, half the time in those panels, it gets rambling and self-serving. So what are we doing today, Jay? We're doing all things health, or
whatever you want to do.
surprise me? No, whatever you want to do.
Okay.
Yeah, really. Talking about marijuana for an hour.
Oh, okay. Write that down.
I'm just kidding.
Some very interesting stuff is happening in Washington.
Yeah, Washington State.
Having to try to figure out a lot of the technology stuff.
On marijuana?
Well, yeah, and the safety of the product. How do you refine it? How do you handle it? What kind of controls do you have for that?
Right. What are your public safety issues? What's the threshold on driving impaired? What's the...
That they've already got in the law. That's a mess. But,
It's a mess, right? Exactly. It's a no good answer.
I think you're a little bit high.
But what control? What things will be allowed when creating hash oil?
Seriously, Dad, if you want to ask a question, I'll turn the mic on for you.
No, thank you.
Good to see you. Sorry we rushed today.
Well, I know every day's a rush day,
Yeah,
What do they say? A busy man has time for everything.
Well, I agreed to do, next weekend we're having a giant healthcare workforce day. So I agreed to go and call earlier, 8 p.m. tonight, which meant getting to Big Island. This for a 2.5-day shift instead of a 2-day shift. Otherwise, it'd been fine. Gone tomorrow morning.
I don't know how you do it all, honestly.
It's just
Good for you, though.
hold it together for now. It's not that hard to do.
Works well. Did you ever think that he would be doing all these things at the same time?
He runs in the family.
Yeah, they do a lot.
Okay.
He and
Father, we had an kid who does.
there's 3 of us.
Well, let's talk about the headline first, Josh.
Are we live? Yeah.
Yeah, what's going on? You have legislation here about the budget and healthcare. What is going on?
Well, the liability on our state worker health plans is extreme. It's many billions of dollars, and it's the kind of thing you have to handle, and you have to handle it responsibly. We are going to put a couple $100 million toward that this year from the budget, and thank goodness that the revenues have been better, but it's really still too little. To be honest, $500 million is necessary to keep up, and the reason to keep up is to make sure our state is sound financially. Bonds, our bond rating, it has to be maintained, and the only way we can do that is by paying more. So it's a good start, though.
Yeah, maybe you could help me understand what the state spends this money for. Because, I pay health insurance money, I pay my premiums, and I get my health care. And the federal government pays a lot of money. What does the state need to fund for this $200 or $500 million?
You made me nervous now. So in terms of millions of dollars, the state funds a large percentage of all of the health care coverage for our public employees. So as you know, because the Prepaid Health Act is very progressive, dating way back to '74, anybody who works in Hawaii gets their health insurance paid for almost entirely by the employer, which is a challenge and also a blessing, right?
At the time that was decided, health care was a lot less money.
Right, and so the percentage that the employees pay is very small. Even in the case of our public workers, we still only pay, it's like 40 to 50%. And so the challenges are great because the other side of it is the state from tax revenues builds up pretty significantly, and also it's been building up for many years. And we have debt associated with that, and that's why we have a $16 billion liability. The good thing is, though, it's manageable as compared to many other states. So I think that our budget and finance director, who's an extremely sharp guy, as you know,
Yeah, we had this program with Calvert Young.
He's a
couple of
great-
weeks ago. He's terrific.
he is a great guy. The governor was so savvy to put him in that position, to put Calvert in that position. He has made the case to Chair Ige and Chair Luke of the respective finance committees that this has to be something that we do. And so we're not turning our back on this liability. We're starting, and I think that you're going to see in subsequent years us increase that amount towards the health liability.
So let me understand the process in the legislature right now. A budget has been submitted,
Right.
and it gets picked at by the various committees. I guess the money committees or all the committees as it goes through the legislative process. How does that work?
Well, the primary responsibility starts with the House. I served there for 4 years. I'm in the Senate now, and the House gives the first go at the budget. They take input from all of the departments. They take input from all of the chairs of the committees. I'm the health chairman in the Senate, and all the priorities are bundled together, looking at what the historic costs for the positions are for each department, what new initiatives they might like to do, and what cuts they might be willing to entertain. That all gets, after several hearings, rolled up into the first draft of the House budget, which then is passed over to the Senate. And during this process, a lot of people additionally have input. For instance, tax breaks, tax credits. People have been looking at these year after year to say, hey, are these good investments for the state, or are they not good investments? So we adjust, like the solar tax credit, for instance. I know you've, I'm sure, been on top of that.
I wish I knew more, though.
What is it, too rich? Is it not enough? Whatever. What's
Yeah.
is it in the state's philosophical interest to be going towards renewable energy? So we assign an amount that we're willing to contribute to that. We
When
also
you say we, you mean the Finance Committee or the Ways and Means Committee, or do you mean the committees that are particularly cognizant of the area?
I think it's both. The committees that are cognizant of the area will give them the expert testimony, and they will say, well, this is what's going on in this state, and this state, and this state, and then how much of a priority do we all, as the entire legislature, place a priority on it? And the governor's team also weighs in. And
So do you weigh in open testimony? Does the chair of the Senate Health Committee go and testify in front of the Committee on Ways and Means?
Typically, no. Typically, we have private discussions about any number of things that we prioritize, but the directors of each department do.
Okay.
And so the directors will come and meet with the chairs and say, look, this is priority for me. What are your priorities as well, going into the session? So that's one big piece of it. And then kind of what comes during the session is an add-on. In other words, a new idea comes up, a new tax credit, a new tax, for instance, or a new program, a loan repayment program for medical students. And then we present that as bills in the form of just separate legislation, and the entire body will either pass it or not. It always has to go through the Ways and Means and Finance Committees, and if it, again, meets the priorities and standards of the whole body and the state, it'll get added on. So that can either add to the budget, obviously, or if we decided to cut a great number of programs, or like we have in the last few years, then we have more money to spend. So we haven't seen a large tax increase of any kind in many years, so that hasn't been one of the big moving parts, although I think you've talked about the TAT tax, the transit accommodation.
Referring to the program we did a couple of weeks ago on fiscal policy in the 2013 session.
Right. So that's how it all plays out. And then the Ways and Means and the Finance Committees are now in conference committee, and they have at it. There's a lot of members on each of those committees, almost half of the entire body, and it's usually not the chairs. If you're not chairing a committee, you tend to sit on the budget committees.
It's important.
Absolutely.
So if there's a disagreement, or I should say a difference of opinion, better.
The disagreement happens, believe me.
Okay, so you want a program. I mean, you want more money, for example, for health care to pay the unfunded liabilities of the state.
Right.
The House doesn't.
Yes.
Okay? The House Health Committee, I guess, doesn't.
Right.
How does that is that ironed out in conference? Is that what happens?
It does. It gets ironed out in conference and by leadership as well. If it's something as large as this, which is a couple $100 million of our budget, that tends to get ironed out between the Ways and Means and Finance chairs, because they're looking at the global budget. They will take into account the priorities of each committee, but something that big usually is their final call. Or say a tax increase. Let's say we were talking about the general excise tax and we were talking about a half point increase. That's not on the table now, but if that were a part of the plan and that would bring in, say, $500 or $600 million additionally a year, yes, several committees would have heard it, but the ultimate and final say will tend to be those two committees. But everyone pretty much has to get on board, because it might simply not pass if it's something that controversial.
Suppose, I would operate on the assumption that if either committee wants to cut, I mean, on either side of the aisle, so to speak, if either committee wants to cut, the cut will have kind of precedence. Or is that not so?
Cuts often do. We always look at unfilled positions or programs which haven't been particularly active. Those are the first things when people are tightening their belts that get cut. We went through a very large round of that the 2 previous sessions when we had approximately 20% cuts in our budget. People try not to cut warm bodies out of work because we're human, and we know that it's just important to us to have our neighbors working, and it's important for the economy. So we try to take every last bit of excess. Also, you tend to see freezes on increases in wages or unresolved negotiations. We even saw furloughs. That was one answer to the budgetary crisis.
Unpopular, but it was an option.
Absolutely, it was an option, and some people felt, they had very negative feelings towards the furloughs. There actually were people that preferred furloughs over a direct wage cut, because if you had the furlough, many people were telling me actually, at least they knew they had that day, so that if they ran a family business or they just wanted time with their children, they had it. So some people actually ended up preferring furloughs over wage reduction.
Well, it sounds to me, and it sounded to me at the program 2 weeks ago, which is, I guess, why we set up the program the way we did, is that healthcare is a major element. I mean, just in terms of the percentage of money in the budget and all that, a major element in fiscal policy in every year.
Yes.
Because the state is so involved in it in so many ways. And one of the elements was the state hospital system, as I remember, which has part of that unfunded liability, isn't it?
It does. So you're talking about Hawaii Health System Corporation.
Yes.
HHSC. And so that is about 13 hospitals statewide, mostly on the neighbor islands. They are the safety net for us as a state.
Medically,
right. And so that safety net, so to speak, always runs in the red for any number of reasons. One, it's expensive. Healthcare is expensive and reimbursements are low. Also, we have pretty high expenses to run our system. We do run it in a civil service way for the union employees, and that adds some cost to it.
And there's no insurance involved, right? This is just dollar for dollar.
Dollar for dollar subsidy.
Out of the state's pocket to take care, with some federal funding.
With a lot of federal funding.
Yeah.
And, so if you go to the hospital, let's say you show up at Kona Hospital, which is one of the HHSC hospitals. If you have Medicare, you have Medicare, and a certain amount of your visit will be paid for. Or if you have Medicaid, of which 290,000 people in the state have Medicaid, a very large number.
You pointed that out at the program. Everybody was surprised.
It's a shocker, and it costs the state, just the cost of the insurance on Medicaid and the program costs the state $1.8 billion, which is a substantial portion of the $12 billion that we budget each year. I mean, it's a gigantic portion. And then it gets paid back into the system and the hospitals run. But if the hospitals run into shortfall and they're in the red, we're not inclined to close them. So otherwise you would have no hospital in Maui if Maui Memorial were closed, or Kona.
Can't do that. It's inhumane.
It won't happen, actually.
Yeah.
So we have to find other solutions, and that one of those solutions is about 10% of the HHSC, Hawaii Health System Corporation budget, is through subsidy, about $85 million, which is an investment that we make as a state to care for the people, so that there's an emergency room or an OB/GYN around if there's an emergency delivery that has to happen, any number of things. So we invest in that, and it's a priority. But it's also why we've had a very large discussion about whether or not to privatize those hospitals, and that's been
hard
one of
to
those.
do these days, isn't it? Look what happened in St. Francis.
It's very hard, right? Well, St. Francis was a cautionary tale, right? We were saying that, some of us, myself included, for years, that because their payer mix, which is to say they had about 65% of their patients were on either Medicare or Medicaid, Medicare for the elderly, Medicaid for those who don't have much wealth, because 65% of those individuals were on those two programs, the reimbursements, which are lower for them as compared to HMSA or Kaiser or what have you, those hospitals always lost money. The nuns made up for it with charitable giving for a long period of time, but over the years they went bankrupt a couple of times.
I remember.
Right, and they finally couldn't sustain it anymore, and so they closed. And we were saying for a long time, look, we either have to increase the reimbursements on Medicaid or Medicare, at least keep them solid, which is a federal question, or we have to get more people insured through HMSA or HMAA or whomever.
That costs money too.
A lot of money.
Yeah.
Or we have to subsidize. And so that facility closed, and then we found that Queens was interested, and so was Hawaii Pacific Health, but Queens ended up emerging and taking over the responsibility. And the reason they didn't just straight up open the next day was because there was significant red ink, basically. There were significant losses, and those Medicare programs, the feds insist that you either make good on it, go bankrupt, or find a buyer that's willing to pay the whole thing down. Well, there was no way Queens was going to step in and first eat tens of millions of dollars and then also refurbish it and then also reopen it. And Queens will lose money at HMC West, now Queens West. But they will lose less money because they have a nice operating system that includes the main Queens campus. And hopefully we're in an emerging period of better healthcare policy, better outcomes, and they'll be able to manage some of their losses. But they will tend to lose some money. It's just they're committed with their 2 campuses to doing this.
How about St. Francis Liliha? What's happening in that one?
I think they're going to be autonomous. They do great work. It's my understanding that they're interested in being kind of a comprehensive care campus for long-term care, care management, elderly care, hospice care, and it's actually very much in the spirit of the tremendous work that the Catholic Church has done, which is to take care of people in need. And I think that they will probably be able to expand. We did pass a special purpose revenue bond and directed monies toward that they can, in other words, get some protection with that bond, get favorable bond rating, which speaks to your initial question, which was why do we pay down our healthcare gap in our budget deficit? Keep our bond rating good, keep our rates good, so that then, in turn, they can build out with bonding, maybe build more long-term care beds, which is important to the state, maybe provide more end-of-life care, which is really a better thing to do rather than put people back into the hospital. So there's a lot of reasons they do good care and why they should stay alive.
You know, your comments make me think that there's a larger historical process happening, and let me throw a theory at you and see what you think. In the past, we didn't have this kind of, may I say, tourists.
Yeah.
In dealing with the budget and dealing with the shortfalls and dealing with the unfunded liabilities and the unliquidated liability. We know it's out there. We have no idea what it is, but we know it's big and it's coming for us.
Right.
Like the homeless. It's a good example there. So was it always thus in your time in the legislature, or are we down a path now where the stress is greater than it used to be?
The stress is definitely greater. I think that's a good observation and a fair observation. I've been in the legislature now. This is my 9th year. So have this.
But it feels like 28.
It feels like more than 9 for sure. I saw it from the perspective of the House and the Senate, right? So I've seen a little bit of both sides. When I first came in the legislature, we were going through boom times, and there were large surpluses, it seemed, and there was actually no shortage of new ideas and programs that were getting funded, in my memory. Then when we hit the recession, we went straight from a place of boom and new ideas and pretty much a willingness to fund anything. And these conversations seem to never really arise about unfunded liability for healthcare, to all of a sudden, oh my God, crash. We have to cut an incredible number of programs, employees, and so on, and furlough people, and it was devastating. And all of a sudden, you heard we're cutting $1 billion, and I think it begs the question of were we just looking the other way at the wrong time? Because yes, of course, we wouldn't increase taxes in boom times, obviously, but perhaps we should have been paying down some of these things in a forward-thinking way. What it tells me is that the very nature of the legislative process is short-sighted. So I don't want to disparage the legislature. A lot of incredibly good work gets done there.
But it works within a short time frame. The biennium time frame, not very long.
Right, and everyone that you meet, that when you're a legislator like myself, wants to do something that seems very good, very productive, can make a good case for a tax credit here to bring solar into the fore. Makes total sense. Or a new program that provides for more students getting into healthcare. Terrific sense. Building a new campus somewhere where we know we're having booming growth makes a lot of sense. These are all going to ultimately, they're going to be nice in the community, and they're nice programs right then. But if you look 15 years out and you haven't taken care of some of these liabilities, you really can end up suffering. And so what I have to believe is that the desire to satisfy people with good ideas is very easy when there's a few bucks around. But in boom times, to say, no, we're not going to do something new, we're going to pay down our liability and build for the future 15 years, that doesn't tend to benefit someone who's thinking politically in terms of the next election. And that's a pitfall that we have to avoid at all costs.
I think it's so valuable to have an MD in the legislature sitting where you're sitting. I mean,
Well, if you have a
don't
heart
think-
attack, it might be valuable.
Well, yeah, if I come and testify in front of your committee and have a heart attack, you can take care of me,
I
right?
promise to.
You know, recess, and then you climb over the bench there.
I'm no economist, but these numbers do. When I look at the health budget, $600 million some dollars, and I look at the Medicaid budget, $1.8 billion, and they continue to grow. Now things are so big that it's harder and harder to get a hold and find the $500 million that are necessary to pay down this responsibility without doing a tax increase, which is always unpopular. So these are the moments, I think, and that's why I so appreciate Calvert and the leaders of the finance committees to take this kind of thing on, because they really are thinking about things in terms of 10 years down the road instead of just 2. And we'll be a better state for it.
Yeah. Well, so, I mean, you think that because of this and other expenses, other unliquidated, unfunded liabilities, we're going to have a tax increase coming soon?
I don't know. I really can't tell
Not
you.
this term, but maybe next year.
We certainly don't have one this term.
Yeah.
We tend to not have them in the second years of bienniums when everyone's up for a re-election. I'd just be candid. It
That's
just
true.
doesn't-
That's the way it works.
It doesn't happen. And we do have good news, and that's that our income from tourism has been blossoming. We saw a 10.8% increase. I think I read in the newspaper like the next guy, right? So we seem to be in good recovery. I'm told by the economists that Hawaii tends to recover faster because the pent-up demand to travel and for people to spend some of their expendable income.
Happy days are here again. Yeah.
Right, and they may not have the wherewithal to go to Europe or Asia, but they can stay here and spend some money or come. We're seeing people come from Canada and from other countries. So our numbers are better. This is a good time to kind of lay a better foundation for ourselves.
Yeah, investment.
Absolutely. But at the panel that you had 2 weeks ago, very good points were made, which were you can only grow the pie so much on tourism.
Yeah.
So we better have some additional answers, whether it's health tourism, whether it is total new industries that we have seen our capability to build. And you'd think here in Hawaii that there's a chance, because we're somewhere between east and west, if we can build out new industries, we'll be fine. If we don't build out new industries and we decide to take care of our responsibilities, which will come home to roost someday, we're going to have to raise taxes. So either we have to be very creative and see that growth for real, or people would at some point expect a tax increase.
Yeah, well, it's got to happen. And that could be on both levels of state and county as well.
It could. I think that the counties sometimes discuss increases in property tax. That's their kuleana. At the state level, it's pretty much the general excise tax or bust. There's really not a lot of other options to bring in revenues that are significant.
Income tax?
Income tax can bring in some extra money. There's always discussion about whether or not we should be exempting so much as far as pension tax and so on. But that's very hard to do to someone who's on a fixed income, and something that I can't say I would ever favor. That was why it was so contentious when we raised the tax for the rail, right? So we're talking about a $5, $6, or $7 billion program that those revenues, I made the case early on. I voted against that tax increase back a couple years ago. I made the case that if we're going to invest in some of the fundamental structures that we otherwise have to pay for anyway. I said, invest $1 billion in the healthcare infrastructure. Why? Because we're going to be paying that anyway. We're paying losses anyway, so it's in our interest to make that the best business possible. It will also help many other things in our local communities, because right now people are having second thoughts about living in some of the neighbor island communities if they don't have an adequate hospital, if they don't have adequate physician providers.
Yeah.
That draws revenue out of the state. And $1 billion investing in a healthcare renaissance was a heck of a lot less than $6 billion in what some people feel is a questionable project for rail. I mean, I'm in favor of mass transportation. I think that there are a lot of reasons to argue for the rail, just like there are reasons to argue against it. But I'm speaking specifically about a 0.5% tax increase that was borne entirely by the people of Honolulu, and not without some pain.
That's very nice of you being sympathetic from the Big Island.
Well, I'm going to go back to the Big Island, and they're very happy we didn't apply that 0.5% tax. They were mad when it was considered, and you would have seen a lot of neighbor island legislators voting against it, which is what happened.
Well, that's the problem. I mean, I think the neighbor islands, if you made a, say, 1%, God, that'd be a lot, but a 1% increase in the gross excise tax, it's regressive.
Yes.
It applies to drugs. It applies to healthcare. I mean, it applies to
Food.
everything you spend. There's no exceptions. Where in other states there is an exception. I mean, in New York State, there would be an 8% tax now. Maybe it's the city and the state, 8 or more percent tax, but it's only on some things.
Right.
If you have a 5% tax in Hawaii, it's really 8 or more.
Right.
You know, when you take the net effect of it, it's bigger than anything else, and it's regressive. This is very hard to do, and then take together with that. There's a lot of people who are close to homeless. There's a lot of people on the neighbor islands. I'm sure you follow this on the Big Island, who are working poor or
Right.
not working poor, as the case may be. They're not doing well, regardless of the state of the tourist industry, and they would take the brunt because it's regressive. You know, this is a hard time
Well,
for that.
I can tell you, you're absolutely right, Jay. Over 50%, just slightly over 50% of those on Big Island do receive some assistance through the Medicaid program, and that would suggest that they're living at or below 140% of the federal poverty limit. Now, that is very little money for families of 4. It is very difficult to get by, and not only that, they're also paying a premium to live further away from the epicenter of Hawaii. So gas price is always 10% higher. If it's $4.30 in Honolulu, it's another 40 cents. It's $4.65 or $4.70 on Big Island. And if you have to drive 50 miles to work, it's not an insubstantial amount of money. It was one of the pretexts that I explained for not supporting the tax increase in general, because you're already, if you live on the neighbor islands, Lanai, Kauai, Maui, Big Island, paying extra to live. There are benefits to living in those places, and it's also why we have to probably be more committed to the safety net services, healthcare, social services, public safety, and what have you. But as soon as you bump that general excise tax, there's no distinguishing who or how it hits you and where you live, and it's a great challenge. So probably a better priority overall is to maximize our bonding potential, maximize our low rates, the benefit of those low rates by having good fiscal policy, and that does help our budget a lot. How much? Hard to say from year to year.
And building new industries like, for example, technology, high leverage, including medical technology, where we can make David Wadamo of Hawaii, in the days of Hawaii Biotech, and also his new Cardax, his newer company, talks about hitting one drug that's successful in this state by a local company could yield as much as all of tourism yields today.
Right.
But you got to build the industry, and he'll tell you too that you got to build the industry with state support, with state incentives. Unfortunately, that hasn't happened, and I'm hoping that it'll happen in the future. But hope, eternal hope kind of thing.
It does bring eternal for sure, because that's where we are trying to find the diamond in the rough. The good news is our budget is, compared to other states, small. So some people say that California is finished economically, that they're so
Really?
large and their debt is so big that to find a game changer for California might be impossible at this point. Not to mention the fact that they have to have a fully voted on referendum to increase their taxes. So California is very different than Hawaii, where, like you say, with a budget of $12 billion a year, and let's say a company were able to come to Hawaii and successfully have a product, maybe even manufacture, and generate, let's say, $2 billion in a year. The revenues that we would get, not just through the jobs, but through the taxes on a company that could generate $2 billion a year, would have a profound and positive impact. Let's look at it this way. We only need an additional $400 million a year to be made completely whole on this liability that you mentioned earlier, which completely locks us in as like a AAA plus state as far as our debt goes.
Then our interest is less.
Our interest is less. Everything turns our way. Well, we only need $400 million. So a couple successful endeavors new industries that emerge that bring that kind of revenue to us could actually change it for the better for us in all ways. Whereas a state like California, which faces probably hundreds of billions of dollars in budgetary responsibilities, really hard for them to achieve that. They're much more fixed in their ways. So I think if we can be innovative and we can bring those people to Hawaii with whatever mechanism we have, whether it's an incentive, a tax credit, just the sheer nature of coming to Hawaii, which often is very important.
I agree.
We do those things, we may not be facing tax increases. But that it takes brilliant people and hard work and some good luck to get that to happen.
Yeah, but it's job number one, and as the chair of a committee that deals with such large numbers, a large part of that liability, you have a great position. I mean, nothing could be finer as far as I'm concerned to have you there.
Thanks.
Anyway, just shifting a little bit, you mentioned about what did you call it? Medical tourism or health tourism, and I remember not too long ago, maybe 10 years ago, there was talk about making this the Mayo Clinic of the of the Pacific. And indeed, there is a certain consciousness in the medical community, I'm sure you know more than me, about faraway places and serving the South Pacific, and for that matter, the medical laboratories.
Right.
They do medical testing for blood and serum and whatever all over the Pacific, and they fly it in, and because there's no other laboratory in the Pacific,
Right.
it's right here. So we become a hub that way. And I'm wondering how are we doing, and what you think we ought to be doing in order to realize that dream, because there's revenue in that dream. Yeah.
There is. We have a couple good examples. Let's start with cancer. Okay, so the Cancer Research Center, run by Michele Carbone, who is a doc, and it's just a phenomenon. He came to us, and his team said, look, if we develop a Cancer Research Center and have it be nationally recognized as one of the 70 or 80 facilities across the country that get the full kind of support of the feds, if we commit ourselves to building that, we can become what you're describing as a medical tourist hub. What he's built over at the campus where JABSM is really something worth going to see. What we did, this was one of, I would say, if we were looking at bills that we passed in the last 8 years that I've been a part of, this was probably the smartest one we did. We passed a tax on tobacco. Increased the tobacco tax by 20 cents per year per pack. So $1.20 over the course of 6 years, and we devoted a third of that money to build this Cancer Research Center, which is now going to bring in hundreds of millions of dollars of advanced research, ultimately patents as well, which could be the game changer that you're talking about. It also makes us a hub in between, of course, Japan and California and the rest of the mainland to provide care for not just the 1.4 million people that live here, but, well, we already have 7 or 8 million people that travel to Hawaii. Imagine if we had another 300,000 or 400,000 people that came for the most cutting-edge cancer treatment and therapy because we've built this facility. It's something that could really, that is a potential game changer for us, and it's now fully funded. We've committed all those monies, which in turn, of course, perhaps you could say the reason, the rationale, clever or not, to do it was to decrease smoking in general, which causes cancer, and to devote that money in its true nexus to this cancer research facility, bringing people that are just terrific, absolutely sharp as a tack, very innovative, from Harvard and Princeton and University of Chicago and everywhere, Hopkins. Bring them here instead, a reverse brain drain. Let them bring great students here. Let them keep our best students here in the health sciences in partnership with JABSM, which is also fully funded, and really be a mecca for healthcare technology and healthcare services, which, as we've already described, are very expensive. They're a driver in many ways the economy nationally, and it kind of makes us special in a certain way. I think that is a great example of what we've done right. And we didn't skim that money off and send it off to the general fund or squander it on some silly road. We actually invested and built, under budget, Michele will tell you, this great facility. So I would say in the next 5 years, you're going to see that as one of the shining stars of Hawaii, along with JABSM, which is another facility that we built in John A. Burns School of Medicine, which they're taking on the challenges that we've been putting out there as priorities. The health physician shortage problem, right? The healthcare provider shortage.
Yeah.
We said, look, we need more primary care providers. What did they do? Dean Hedges and his team Kelly Withy, super smart, Roy Magnuson. They turned it on its head. They said, we've got to get more of you going into primary care. So now you're seeing 2/3 of those students going into primary care. So we'll get those doctors staying here in Hawaii. We won't be shipping people from Big Island, Maui, Molokai.
By aircraft, and air ambulance costs a lot of money.
It costs a lot of money, and it's $200 a pop if you're healthy traveling. It's $1,500 to $4,000 probably if you're in an emergency just to get the plane going. That's the big driver in many ways of the $1.8 billion budget item that I have to deal with in my committee. But we're actually investing in a better system, and Japson's helping us do that. So though people, they get down on government, and I respect that. I'm there with them most of the time. But there are some successes that have been both smart, will be sustainable because we've invested those resources in them, and actually healthcare is one of those areas where you actually can grow your dollar. So I'm optimistic because of some of those programs.
Yeah, Hawaii, to a certain extent, it already has the reputation and the statistical fact of being one of the healthiest states. This could be, the weather, maybe, or it could be the ethnic quality of the place. Diversity actually is healthy.
Yes.
It could be the diet, who knows what.
Yes.
But it does have the reputation, and we can take that to the next step and make the reputation, build in within the reputation this Mayo Clinic kind of facility. We could draw people from all over the world to come here and enjoy. It would be a wonderful thing.
It would be, and let's just say we get one of those game-changing moments where Carboni's team brings somebody in and they develop that next drug, and we decide to invest some money to have a plant here. I mean, that could be an extraordinary thing for a state of our size. There are other states around the country that thrive because of scenarios like that, not health. There are some states that didn't have budget problems. Why? Because they had minerals that were needed in perpetuity. What is healthcare? Healthcare is the ultimate mineral in a way. You always have need. Every single one of us has need for healthcare. Every single one of us needs a health professional. Every single one of us needs to rely on innovation for the next generation of healthcare products, technologies and what have you. So it is, if you do it well, that mineral that you could thrive on.
Yeah, and that's why it's important to keep the infrastructure up so that we don't lose that edge, so that the world looks and it sees a good thing in our health infrastructure. But, I remember Kaka'ako, because I followed Kaka'ako very closely between, say, about 2000 and about the late 2000s. And there was the Cadman dream, if you remember. Ed Cadman, the first dean of the medical school, a wonderful man.
I met him twice, yes.
Yeah, what a guy. And he was, his view of it was that one day around the medical school there would be big pharma. They would come, all the open space, there isn't that much open space, but all the open space would be populated by these, big board and NASDAQ pharma companies doing research and hiring local people and, being a mecca for pharmaceutical research. It never happened. I mean, and it doesn't look like now it's going to happen. Is that a big loss? Can we recoup on that? Where's the future in bringing out, Linda Lingle said that she was going to call one of those companies every morning. She said, we're going to get up early, call one of those companies and try to, bring them out. Never happened. So query, how much have we lost in not doing that, and could we do it now?
That's great. I was in medical school when that was going on, okay? So that was before me, but like I said, I did get to meet Dr. Cadman. I'll tell you, it is possible. It's only been in the last, say, 2 months that we launched the official opening of the Cancer Research Center.
Is it open now?
It's open now. It's open for business, and he's recruiting people actively. Sometimes you have to reach a critical mass of support, scientific colleagues, and investment, and actually the building had to be built, which is only just done in the last couple months, to really get that to happen. So whoever's vision that was, maybe 10 years ago, whether it was Dr. Cadman or whomever, they were very, very savvy, because over time, I cannot see that place failing, frankly. There's no way it'll fail. It already runs on its own steam, and so it's really doing well. Usually you just need a couple successful labs to take that leap of faith, and I'm seeing them. I'm already meeting them. We had a Nobel Prize winner here that Michele brought over at one point about a month ago for the grand opening. These people are coming and engaging. So on the one hand, you have Hawaii, which is something magical to most people, and many people, say 2/3 into their career, when they're deciding what's the last major phase of my career, they may come very possibly to Hawaii, provided that there's this infrastructure, which is now there. I think it will build steam, and we'll see some of that. I can't speak for the Fortune 500 companies, whether it's risky to uproot and go somewhere, but I could imagine very easily that they send some of their research components and teams to Hawaii to be a part of what's going on at the combination JAPSOM and Cancer Research Center campus. And once something catches on, it will go gangbusters. So I'm pretty optimistic, frankly. As to making those calls before the place was built, I wouldn't have brought my Fortune 500 company on kind of on spec. So
That's what it would have been, yeah.
yeah, and it's not on spec any longer. And
Yeah.
so I do believe that that's going to be an area of great success for us.
You know, the thing about the Cancer Research Center is it needs researchers who get paid well,
Right.
and who have nice jobs. I mean, if you ever visit those laboratories, you know how swell it is,
Yeah.
and how intellectually satisfying it is to do that, and as well as the compensation. And at the time that Ed Cabot was thinking about this new Kaka'ako and all this big pharma, we didn't have anybody.
Right.
You know, now maybe through the Cancer Research Center, we will have some people. You know, we will propagate a generation. Maybe we will encourage the kids in school to study for this, and thus we will create a knowledgeable workforce in that area that'll change everything. You know?
Oh, absolutely. Well, this I don't want to get ahead of myself, but for instance, one of the bills that we have this year is a bill. It's I think it's Senate Bill 665 or 667 that is a pipeline bill, which reinforces what you just said. It pays for the pipeline of young students coming out of high school, college, into the professional programs, whether it's medical school or public health degrees, to really get them in, pay some of their loans down, and get them to stay here in Hawaii. And by keeping that flow of our own intellectual asset here in Hawaii, that's what we're hoping. So yeah, we'll populate these labs somewhat internally, but also externally, because the time is now. We can't afford, it was a big expensive project. We can't afford to fail, and we won't. So I know that they are actively recruiting and frankly taking from major institutions some of their best people, whether it's the novelty of coming to Hawaii, whether it's the newness of the Cancer Research Center and its prospects that it's already funded and supported, or just because sometimes people want to change. And a lot of our professors that have now decided to stay here, they reach out to their colleagues and say, hey, something interesting is going on here, you ought to join in on it. I think Hawaii is inherently an exciting place for people to come to. I know I came for that reason to some degree, and many of us did who transplanted here. So now there's an even greater reason if this industry is one that takes off.
Yeah. Well, it'd be wonderful to see it happen. I mean, it'd be a dream come true. I wonder if there's some kind of incentive that the legislature, I mean, beyond what you've said already, could do to incentivize people to go into the field. There used to be an education and training fund that would help pay your school for the kind of thing, so that we encourage. Likewise, something to keep the recruitees here. Ed Catman recruited a number when he started, and I'm sure that Michele is doing the same thing, of big names in the medical community to come out here and participate in research. Some of them stayed, some of them didn't. Some of them were stolen off by other states and other, and by Asia.
Right.
Dwayne Goulber, great infectious disease man, part of the university, was running a big laboratory. In fact, Catman built him that laboratory on the other side of the medical school in the research building. He's in Singapore now. He's not doing anything here.
Yeah.
We lost him. And when you see all those viruses in China, you'd say, oh, we could really use Dwayne right now.
Yeah.
But how do we keep them here? What kind of incentives can we make, so that they'll be really comfortable and happy and stick to it?
Well, you have to pay people well, of course. If they're performing well, I'm a firm believer that you compensate people who work extremely hard and who go the extra mile to improve themselves. Pay them top dollar, and they yield top results. So there's no question that we should do that. There are some models that suggest that if you just make an environment kind of more comfortable for a family, that they'll stay. I went to an institution where the faculty all had interest-free mortgages provided they lived within 5 miles of the college. That was Swarthmore College. An incredible number of faculty were drawn to that, and that's a world-class college, and it keeps those people there for the entirety of their careers. There's a lot of things that can be done, I would expect, that just the true nature of being in Hawaii, being in Kaka'ako, being here, goes a long way to doing that. But we have a high cost of living, we know that, and so if we're going to get people to translocate their labs, we have to make sure it's economically smart for them. There's so many ways to do the right thing. And I mean, sometimes it has taken tax credits to do it, but it's got to be in the taxpayer's interest, of course, and that is something that when a lot of people are struggling, it's hard to do.
It's hard to do. People
Yeah.
don't like to see the other guy get a break they're not getting.
Yeah, and if people are struggling with fundamentally high cost of living, and they're middle class and they're really taking a beating, or other people are seeing pay cuts, it is hard to justify, and that's when even people who are doing great have to be understanding and go the extra mile and wait out the tough times, because we are all a community after all. So it would be unfair to have too many tax breaks for any one industry when the rest of the state's struggling. But if you do look at it in terms of long-term growth, sometimes it's very smart to invest, because those big inventions or new industries will pay for the public school system. They will pay for the support of the public hospital safety net, like we've talked about.
Mm-hmm.
So we can't be short-sighted either.
I'm thinking that a rising tide raises all boats. So all you have to do, Senator Green, is make this a nirvana. See.
Yes.
If you can just make it a nirvana, then they will come from miles around, and that will be incentive enough to bring the best and the brightest and the sweetest people here, don't you think?
I think so, and that's in some ways what we try to do. Hawaii gives everyone healthcare coverage. We always have. There's always a small number, but the smallest in the nation typically, of uninsured. It of course is one of the most beautiful places to live, and so even if you don't have wealth, you have the outdoors. That's why there's a constant large struggle between development and open space. It's fundamental to the way people live here. But it doesn't feel like nirvana if you get laid off, right? So it is an incredibly complex organism to be in a small state, about 1.4 million people, in confined geography with large need. So yes, it would be great to have some more cash to make it even better.
All we have to be is as smart as we possibly can be, something like Singapore, I think.
Yeah.
But what about the neighbor islands? I did want to ask you that before we broke, and I worry about the neighbor islands. My wife and I used to have a home on the Big Island in Hawaii, as a matter of fact.
Really?
We love the Big Island. And I worry about them because of the fact that there are not enough specialists out there.
Right.
You must see that all the time. And how are we going to fix that? Are we fixing it now? In what way are we fixing it? And if not, what are we going to do in the future to fix it?
I didn't realize you owned a place in Hawaii, but I'm going to catch a plane an hour after our meeting to be the ER doctor tonight in Hawaii.
Oh, very nice.
Period. So it's that's not a
little
setup.
wee hospital there, yeah.
Yes, that's not a setup question. I will be the doctor for 60 hours this weekend, and that's a challenge. The absurdity, right, that the senator has to go back and still be the doc to keep us covered for healthcare purposes.
It's a wonderful thing. It's a mitzvah. Very
Well,
nice thing.
maybe so, but it's hard to imagine that we could be that hard up for healthcare providers, and it is a giant challenge. We're about 18% short on healthcare providers statewide, and that's not even the worst news, because 2 years ago we were 22% short. So we're seeing some improvement, and we're hoping to continue to see that.
That's an improvement, right? That's great.
It's an improvement. We have committed ourselves to loan repayment programs that bring federal matching dollars. We have done everything possible to recruit specialists into the neighbor islands, but the truth is the populations are small and isolated, and to have a neurosurgeon, for instance, a neurosurgical team on the Big Island is virtually impossible, just because the population is simply not big enough to sustain a well-trained, well-oiled machine.
And experience counts, so you don't want a neurological surgery team that hasn't done it.
That hasn't done it more than 20% of the time
Yeah.
like they need to. So that's why we have to invest in other smarter approaches, which is why we're spending extra resources on medical transport. Why I mentioned earlier that some of that tobacco tax dollar went to the Cancer Research Center. Another full third of it went to the trauma system, which is moving people between the islands, which is paying for some specialists in the most necessary ways to go and work on the Big Island, to go work on Maui. So some of those monies are directly going into services. So even if the Big Island were to double its population, it still might not have certain subspecialties. But we might have decreased the amount of travel time or transit time by 80% because we got a better system together. So there's going to have to be some interesting solutions, telemedicine, all these other things.
Telemedicine. I wanted to,
Yeah.
there was a bill, I guess it's going to be successful, allowing testimony by video conferencing. This is a good thing.
Yes.
And there should be a bill allowing government boards to meet by telephone, because it saves money on all that travel. But I'm wondering if there's something the ledge can do to incentivize video conferencing with doctors. HMSA tried something like this a few years ago.
Right.
I don't think it worked all that well.
It was a little ahead of its time, I have to say.
Yeah.
And it was a noble effort, but things are changing very rapidly because of the Affordable Care Act. Not all of which is good, and not all of which is bad. Like you hear both sides say, pointing fingers at the other. But we are seeing a major move towards increasing technology in healthcare for many reasons, too long to get into tonight. But I will tell you this, that having extra telehealth, which will be reimbursed as the systems go forward because it's more economical, is going to be a reality. There's already some major hospital institutions that are using that in all of their emergency wards, in all of their intensive care units from afar. You can never replace a stethoscope on a person's heart from the doctor. There's no question about that. But there are many parts of healthcare that have become so technical and basic but expensive that can be replaced by certain technologies. And I think in this day and age when my 2-year-old can turn the iPad on and start an app, and that's an honest to God truth about Sam, and my 6-year-old Maya is navigating the internet like crazy.
It's just chip off the old block kind of thing.
Well, they're better than I am at it, for sure. And I tell you, that generation will rely on technology for healthcare. They will rely on technology for communications at all times. And it's not that far off. These are people that are going to, be taking care of all of us and our parents in the coming generation. So I know that that's going to be important, and that's one of the positives of the Affordable Care Act, and it's going to be particularly valuable to us as an island state. We will have to deal with all of the other uncertainties about the Affordable Care Act, whether it's Medicare reimbursements going down, that could have an impact on us, whether it's the health insurance exchange and how that affects us, or the health information exchange, which will cost money. But all of these things have a lot of good people working on them, and our hope is that looking 2, 4, 6 years down the road, we actually, instead of worrying so much about whether we have a 18% shortage or a 22% shortage of providers, we say, have we had a magnitude of order improvement in our capacity because we had the technology, because people didn't have to travel for 4 or 5 hours to get to Oahu, wait for their subspecialist, wait for their tests, maybe stay over a night, then go home. If we could just cut 20% of that out, we could see a game changer in those $1.8 billion budgets that I described.
Well, we're having another, I thought to ask you early on about the Affordable Health Care Act, and we haven't discussed it except for a minute or two. And so we got to make plans, Senator Green. So in fact, I'm talking with Ginny Pressler of Hawaii Pacific Health. We're going to set up another program.
Yes.
We're going to talk about Hawaii under the Affordable Health Care Act, and I hope you can be part of that. That'll be in a couple of months from now.
I absolutely adore Ginny, so anytime I can be near her, I'm going to learn something.
Well, let me ask you one more question. Are you enjoying this? Are you going to keep on doing this? It seems like a lot of work and a lot of stress, but you seem to do it so well and like it. So tell me how you feel about it.
Yeah, I'm sticking around for now if people will have me. It's we've reached an equilibrium in my own household, so my wife Jamie expects me to be gone and earn $1 or $2 in the ER to give me the flexibility to really devote time to this. And people are so generous with me at the Capitol because I'm not a typical legislator, but I do bring a little bit of healthcare perspective day in and day out. I will probably make comments to colleagues on Monday or Tuesday about what I saw in the ER this weekend up in Hawaii, and that has some value. So I enjoy that. I don't mind fatigue so much, but there's a lot of great people out there, people like you and Ginny in particular, who know much more about health policy. I just try to add that clinical flavor. And yeah, I'll stick at it for a while if people have me.
That's Senator Josh Green, actually. And the one thing I would leave you with, and he doesn't have to respond to this, is that a doctor serving in the legislature, a doctor working only part-time as a doctor, could make a lot more money if he wasn't involved in public service. And yet, he does what he does for public service. Thank you.
Well, I'm working full-time anyway, so it's my pleasure, but thanks for having me, Jay.
Thanks.
You bet.
She's outside where she let us off.
Oh, yeah, what?
She's right where she let us off.
Oh, you're gonna meet her
She's
again?
the other.
Okay, that's well, full service.
Love it. Thanks. Okay.
Thank you.
Great to see you, man.
Great to see you. Thanks for coming down.
Of course.
This is your son.
Yes, I know.
What a job.
Yeah. Thank you. I didn't do it. That's all right. Okay.
You okay?
Yeah,
Great.
great.
You had a great show, Jay. I've
Yeah.
never seen it before.
That was just fun.
It's been great.
Awesome. Okay, off to the plane. It's funny,
Okay.
I am on call at 8 tonight.
Our house was just behind the Mormon gym.
Really?
Yeah, up there in Buckeye.
Awesome.
We had almost 20 years there.
It's wonderful there, really. Different world, right?
Okay, thanks you guys. Thanks.